Hi, I'm Dr. Miller, and today we'll be talking about the opioid crisis in Massachusetts. Opioids are a class of drugs including heroin, fentanyl, and prescription pain relievers such as OxyContin, Vicodin, and more. This epidemic has hit Massachusetts very hard, and numbers show that this crisis is 2 times worse here than the rest of the United States. In the first 9 months of 2020 alone, there were over 1,500 opioid-related deaths in Massachusetts. This epidemic is not exclusive to just one community. In 2018, over 80% of drug-related deaths in Black, white, and Hispanic communities were opioid-related. Opioids can be acquired in a number of ways, including doctors, they are sold on the street, and even prescribed for pain post-surgery. The issue with this is that these drugs are often abused and people are able to get more easily, which only fuels their addiction. Risk factors for opioid abuse include age, existing depression with the use of certain medications, and a history of abuse or dependence. So, how can we combat this crisis and see a decrease in the abuse of opioids in Massachusetts? This process starts with doctors. Doctors should ask their patients about current medical and non-medical drug use to help recognize possible misuse of any medications. Next is pharmacists and how they can help combat this crisis. Pharmacists can be a huge help in recognizing unusual patterns in a patient's prescribing and dispensing of medications. In some regions, pharmacists have the ability to contact other pharmacists in the area to let them know of a patient's unusual pattern of medication and possible abuse of substances. Finally, we have the patient themselves and how they can educate themselves on how to properly use the medication prescribed. Patients should follow the proper dosage of their own personal medication and not take other people's medication, as well as properly storing their own medication so that other people have no access to it. With all of this in mind, let's hope that Massachusetts can properly combat this opioid crisis so that we can see a decrease in the amount of opioid-related deaths. Thank you for listening, and stay safe.